Hello, everyone. This is the Hormone Cancer Connection 3-day summit. And yesterday, the previous, if you were following along, was about cancer specifically. So the truth about cancer. And now we're going to go into the actual hormones of cancer and the role that they play. So before we get started with that, I'll reintroduce myself. I am Marcia Jones. I am a nurse practitioner, and I specialize in functional medicine, specifically hormones. And I've been dealing with hormones for quite some time for both myself and my patients. The management of hormones is pretty magical because it makes you feel better, and you don't realize at the same time that when we're balancing these hormones and you're getting your life back, that we're actually protecting you from other issues such as hormone related cancers. Hormone related cancers are on the rise right now. 1 in 3 women in their lifetime will develop a hormone related cancer, and 1 in 2 men. So those are pretty astounding statistics right now. I have marciajonesnp.com, which is how you most likely found this, or you found us on Facebook or maybe Instagram. But this is a hormone-focused functional medicine clinic that empowers women to live a life of vitality and reduce their risk of hormone-related cancers. And so that goes along with the fact that I said, you just want to feel better, but I know that I'm reducing your risk by helping you to balance your life and get things back in order. So this is day 2, and this is where we're covering the hormones and the common hormone-related conditions that increase your risk of developing cancers. Those hormone-related conditions are things like PCOS and endometriosis, which are also very common right now, and I see a lot of. Tomorrow, on day 3, that's going to be the hormone-focused cancer care. This is where we start putting together the definition of cancer, the hormones of cancer, and what we actually need to do to start balancing those, and how we work to bring everything into alignment. So if you are watching this and you know someone, particularly females, we all know some ladies in our life that this might be beneficial to, please share this. Registration is going to be through September the 14th for this program. So if they register, we get the email address, then this is going to be sent to them so they can see all 3 days: the truth about cancer, the hormone of cancer, and then the hormone-focused cancer care. They will get all of these recordings. So cancer, let's review our definition. Cancer is a lifelong, genetically predisposed metabolic disease of the mitochondria that requires a lot of energy, resulting from an immune system that has been broken by toxic exposures and lack of nutrition, fueled by inflammation, which is rapidly on the rise, targeting estrogen-dependent reproductive organs, and the #1 cause of death in the United States. This is the basis for our entire program. So now into the hormones of cancer. As I'd said, 1 in 3 women will develop cancer in their lifetime. And breast cancer is the #1 cause of cancer. So the hormones that play a role into this, they are critical. Hormones are critical. We have more than 45 hormones in our body, and they work as messengers. They're chemical substances that talk and put everything into alignment because they zoom around and they talk to each other. And if one's off balance, they try to rebalance the other one and do this thing called homeostasis. It's because our body is very resilient. And our body, when it's given the nutrients that it needs, when it's given what it's need to function the way it was designed to function, it is resilient. The body can heal itself, and the body can bring everything back into alignment and help to protect you and rebuild and repair from whatever destruction you may have been through or imbalances. So hormone imbalance, these are some of the signs of hormone imbalance or the results of hormone imbalance: fatigue, mood swings, anxiety, depression, poor sleep, decreased productivity, increased risk for cancer, bloating, low libido, chronic pain, and weight gain. And I am sure, ladies, that you may have experienced 1 or 2 or even all of these at some point. Now, when we get your hormones balanced, this is what you can expect: energy, weight control, improved sleep, and inner peace, balanced moods, clarity, and empowerment to take on your goals. Then there's the strength to face and fight challenges. Of course, overall health, a stronger immune system, and we're going to reduce that risk of hormone-related cancers we're focusing on right now. The primary hormones of females are estrogen, testosterone, and progesterone. There are many others, but we're not going to go into those details, the finite details of those things. That's my job. You just want to feel better. These are the ones we're going to focus on. So estrogen is produced naturally, but it is very controversial. And it's very controversial because there was a study put out several years ago. That was the Women's Health Organization study that was using synthetic hormones for replacement and determined that estrogen was bad and that it increased your risk of cancer and that we shouldn't give women estrogen. But yet, estrogen is vital to us being women. And if once we go through menopause or we have a surgical intervention that, decreases our production, we go through menopause and everything changes. Like everything changes. So based on that one study, which was poorly designed and not quite fair in the way they reported their results, and they failed to educate people fully on it, we have controversy. And now ladies are afraid of estrogen. But I want to help you to understand this a little bit better and guide you through the truth about estrogens and hormones. So estrogen, we need it for breast development, production of our endometrial lining. So that's the lining inside of the uterus, maintaining vaginal tissue, bone development, neurotransmitter regulation, and for cardioprotection. So cardioprotection means our heart. It protects our heart. When we have estrogen and we're in premenopausal years, we are protected from heart disease. Once we start to go through our menopausal years and we start to have a declining of estrogen in our body, our risk of cardiac disease goes up there with that of men. And when I say neurotransmitter regulation, this is because serotonin is actually in the gut, is where most of serotonin is produced, and it has to do with estrogen regulation. Bone development, making our bones strong, it requires estrogen. The vaginal tissue, that is when we're younger, the estrogen keeps everything supple and moist. Sorry if you don't want to hear all those terminologies, but it's the truth. And as we get older, that lining starts to get a little drier and uncomfortable, and has to do with sexual dysfunction because we're lacking estrogen. And then, of course, our breast development throughout the years, and that is why estrogen has a lot to do with breast cancer development. So estrogen can be either protective or it can be dangerous. And that's because of pathways that it takes. So all those communicators that I told you about, all those messengers, the hormones, neurotransmitters, they have to do with what pathway estrogen takes in our body. And estrogen is a broad term for 3 different types. There's estrone, estradiol, and estriol. Now, estrogen exposures and poor metabolism of estrogen, that is the primary factor in development of these hormone-related cancers. So this is where the importance comes in. This is where that study was lacking, and this is where all of our information is lacking, and where the confusion and the controversy comes in. Because when you know where you're getting these exposures, where you're getting this imbalance and this dominance of estrogen of a wrong type, then you're going to know what your risk for cancer is. You're going to know how you can balance this and how you can decrease your risk. So these are all the things we have to look at and we have to manage when we start to do, hormone-focused cancer care. These are some of the estrogen exposures that can increase your risk. Birth control. We use birth control in our younger years and throughout our reproductive years. And the birth control most often has an estrogen in it, because estrogen and progesterone, they help to balance whether, that endometrial lining builds up and when we're fertile and when an egg can be implanted. And then there's hormone replacement therapies. So I already alluded to the synthetic estrogen that was actually made of horse urine, and that World Health women's health study that said that estrogen increases your risk of cancer. Well, if it's the wrong type of replacement, yes, it can. Bioidentical hormone replacement, that's what I do a lot of. And when we use bioidentical hormones, we are mimicking those hormones that are in our body that are just the way that we have estrogen made naturally. So that is the safer way to do hormone replacement. But even with hormone replacement of a bioidentical type, we have to be very cautious that it doesn't go down a wrong pathway because you're not balanced. And if you have an exposure to things like xenoestrogens, which we're going to talk about in a minute, then you have an increased risk of hormone dominance, estrogen dominance that can go down a wrong pathway. If you don't eliminate properly, meaning go to the bathroom properly, then you have too much estrogen and you're going to end up with problems. Then we have animal products. This is why I'm a plant-forward, plant-based, plant-loving person when it comes to talking about nutrition and balancing hormones. And I'm not saying that you can't have meat. I'm not one of those that says, oh my gosh, never, ever, ever. We work within everyone's life because protein is important. There's a lot of nutrition that you can get for protein, but I also want you to get plants, lots of plants that have different types of nutrients in them that fuel our body to help us with the mitochondria, to help us with these things called cofactors that keep everything into alignment. Like estrogen has a lot to do with the B vitamins. Progesterone needs B vitamins. Lots of different vitamins and nutrients are needed to make our body work correctly. So with animal products, that's dairy products, that's meat itself that comes from an animal. You want to make sure that you get organic meats that have not been injected with hormones. The locally raised are the best type that you can get. Then we talk about adipose. So if you are overweight, you have adipose tissue. Adipose tissue or fat cells, they produce estrogen and they produce inflammation. And when we have estrogen and we have inflammation that is of the wrong type, we have this overabundance of estrogen, we have this risk for hormone-related cancers. So being overweight is a primary factor for developing hormone-related breast cancers. Alcohol, and this has to do with your breakdown. There's these enzymes that are used to break down everything in our body and process it and eliminate it appropriately. Well, alcohol and estrogen, they share some of those same enzymes. So if you drink a lot of alcohol, or if you drink alcohols that are more of a grain type alcohol instead of things like a wine, which is made of a grape, which has resveratrol and quercetin, or ones that have a lot of sugar in them, you're going to increase your risk for estrogen imbalance because of an estrogen dominance. Now, the xenoestrogens I talked about, these are very similar to our estrogens, but they are not exactly like our estrogens. So they're fake estrogens. And these are in personal care products and home care products. These are what we find in our makeup. They're hair care products, things like dry shampoo, candles. All of these things, there's xenoestrogens in those, and that puts us at risk for an estrogen imbalance. So make sure that you are reading labels. And one of the things that I like to do is give you resources for, ones that are made naturally that you can use that are not going to increase your risk of problems. Now, progesterone, this one is like the pregnancy hormone. This one helps to regulate our menstrual cycles. It's produced by the ovaries, and it plays a role in breast and uterine activity. So it's kind of like estrogen and progesterone are the yin and the yang. They balance each other. One does one thing, one does the other. So they need to work in a perfect relationship with each other so that things are balanced. And a lot of the disorders that we're going to talk about that have to do with hormone imbalance have to do with your progesterone and your estrogen being out of balance. Now, testosterone, this one always surprises ladies that they have a lot of testosterone. We have a ton of androgen receptors throughout our body. Testosterones are androgens. They are the male hormone. But just like men have estrogen, we have testosterone. We don't have as much testosterone, but we do have testosterone. The problem with testosterone is that it can be aromatized into estrogen. And remember that word, aromatized, because aromatization increases estrogen dominance, and it doesn't always go down the correct pathway if you don't have the right nutrients to make it the correct type of estrogen that mimics what we need to have in our body. Aromatization is the process of turning androgens into estrogens. Again, this happens in men and it happens in women. And when you have aromatization, it has a direct pathway to the breast tissue for some reason, goes right on in and increases the risk of breast cancer in both men and women. Now we're going to shift into our hormones to the hormone insulin. Did you know that insulin was a hormone? Insulin is a growth hormone. It is a metabolic hormone. It promotes tumor growth, and it is pro-inflammatory. So if you have insulin dominance, you're going to have estrogen dominance. If you have insulin resistance, you're going to have estrogen issues. Insulin makes you gain weight. And we just talked about what happens if you have adipose tissue. So too much insulin makes you gain weight, increases your estrogen. Insulin is a metabolic hormone, meaning that it has to do with the metabolism of glucose. We talked about glucose metabolism in our first session when we talked about the mitochondria and the metabolic disease that cancer is. If we cannot balance our glucose, we are feeding cancer cells. We are giving them an endless supply of fuel to replicate. And this is part of how tumor growth happens from an excess of insulin. And then it increases inflammation. And we talked about inflammation in our first session also, as to how that is like putting gasoline on a fire when it comes to cancer. So cortisol, that is our next hormone. Oh, I'm getting ahead of myself there. Cortisol is a stress hormone. This is another one that is a big deal right now because of the world we live in. We live in a high stress society. We are always on the go. We never stop. This stress that we have constantly in our life, even if it's the stress of not sleeping, puts out cortisol. Cortisol is a stress hormone, as I'd said. It is a metabolic hormone because if your cortisol levels are off, your glucose levels are off, your insulin is going to be secreted to balance out the glucose. If you can't metabolize the insulin and the glucose correctly, and you have circulating levels of cortisol, you have circulating levels of estrogen. So I'm sure you can see how this is all starting to roll together. This is why it's complicated, but this is also why there is an abundance of cancer among us right now. And this is why we need to change the way we are living and the way that we balance our hormones to decrease our risk of hormone-related cancers. Cortisol is a reproductive hormone because it has a direct relationship with our estrogen, our testosterone, and our progesterone. Cortisol has a role in immune function. If you have too much cortisol, your immune system is going to suffer. You're going to have a poor immune system, a weak immune system. And as we talked in our first session, when our immune system is weak, that is when the cancer cells can hide, they can go undetected, and they don't get destroyed and they don't get eliminated from the body by the immune system, and they start to take over and replicate rapidly. And then cortisol can also regulate inflammation because of a lot of these other growth factors that we have and hormones that we have in our body that secrete inflammation. I think I'm making a pretty good case here, right? I think maybe you're starting to figure it out. Wow, this is a big vicious cycle that we need to start to control. And when we start talking about hormone, focused balance of cancer care, we do one thing at a time and we make it all work together. We're not going to change any of this overnight. It takes time and it takes a lot of effort and it takes balance. So the conditions of hormone imbalance, speaking of balances, so these are estrogen related conditions. Obesity, as we've talked about, endometriosis, we've talked about, PMS, PCOS, and PMDD. We're going to go into those a little bit more in detail. Obesity, it is a direct risk factor for the development of hormone related positive breast cancer, and it has been associated with an increased risk of recurrence and reduced survival of cancer, specifically breast cancer. That is because of the estrogen imbalance. That is because of the dominance, because you not only have your own estrogens, you have xenoestrogens, your adipose cells are putting out estrogen. So it is just one big estrogen party. It's a dance of estrogens, and they are not all the right estrogens. So by losing weight, by balancing hormones, you will lose weight. And by losing weight, you will decrease your risk of breast cancer. You will decrease your risk of hormone-related cancers, and you will increase your chance of survival. Obesity is inflammatory because it does not only put out estrogens, it put out inflammatory cytokines. These are other chemicals that our body releases, those messengers that are inflaming things. And when you're inflamed, again, putting gas on a fire. And when it comes to cancer, it causes that cancer to spread out of control. Obesity is a metabolic condition that's associated with poor glucose metabolism. And there's those elevated insulin levels. And then, of course, adipose tissue converts androgens into estrogen via aromatization. There's that word again. So I gave you the foundation. We're putting it all together here to help you make sense of how this is all going out of control. I used to do weight management. And when I say used to do, it's because I was focusing on weight loss, because that is what everyone came to me for. They wanted to lose weight. But then, as I was seeing, there was a bigger picture, I felt that it was important to educate on this bigger picture and to start working on the hormone focused balance, because women also have difficulty with their hormones, as we're going to go into for more. And when I balance those, they naturally lose weight. So instead of just worrying about counting macros, counting calories, and weight loss, which can become a little bit obsessive and restrictive, I work on balancing the hormones, and the rest just follows in naturally. Now, PCOS, polycystic ovarian syndrome. This is a disorder of increased insulin. This is a disorder of increased cysts on the ovaries because of increased insulin, increased androgens, obesity, and anovulation. So anovulation means you're not putting out eggs. So you have to, have eggs released to be fertilized to get pregnant. If you're not releasing these eggs because you're not ovulating, then you're not getting pregnant, you're infertile. And that has a different imbalance that goes with it. Signs of PCOS are irregular periods, ovarian cysts, excessive body hair, weight gain around the belly specifically, acne or oily skin, and infertility. Endometriosis. This is on the rise and not as commonly talked about as PCOS because it requires a different way of diagnosing. It's more diagnosing of symptoms, because to find actual endometriosis, usually it's an exploratory surgery, and that's kind of extreme. But what happens with endometriosis is that the endometrium is growing outside of the uterus. So the endometrium is that lining of the uterus that keeps all things ready for an implantation of an egg if it's fertilized. And, with menstrual cycles, if the egg is not fertilized, we shed our lining, and that's how you have a menstrual cycle. So this endometrium starts to grow outside. It starts to grow in the abdomen, in the pelvic cavity, on the ovaries, on your bowels, and causes a lot of problems. And it's associated with very high estrogen levels. So that's why endometriosis is on the rise. And it has an increased risk specifically for ovarian cancer. Ovarian cancer used to be quite rare, and now it is on the rise, and for younger women than it used to be. So some signs of endometriosis are painful periods, painful sex, chronic pelvic pain, painful bowel movements, and low back pain. And this is because the endometrium is considered foreign. So if it's outside of the uterus, it's not where it's supposed to be. And anything that is not where it's supposed to be aggravates and inflames that area. And when it's aggravated and inflamed, you have pain. Irregular menstrual cycles, this results from an imbalance of hormones, obviously, as we've been talking about. And it is a high indicator for an increased risk of hormone-related cancers, because as I've went over, there's a lot to do with the estrogen and progesterone balance. PMS, hormonal disproportion of estrogen surplus, and progesterone deficiency. So those ups and downs that you get all around your menstrual cycle, this is because you have too much estrogen and too little progesterone. Symptoms of PMS: weight gain, abdominal pain, headaches, swelling and tenderness of the breast. That's because of that increased influx of estrogen. Nausea, constipation, anxiety, irritability, and anger, mood swings, crying, you name it. There's where it's all at, is PMS, and it has to do with estrogen. Then we have premenstrual dysphoric disorder. This is a more extreme symptom of imbalance. This is an actual literal psychiatric diagnosis in the mental health world. And a lot of times women are given antidepressants and anxiety medications when really all we need to do is balance their hormones. A little bit of, progesterone and learning how to decrease your estrogen levels will help you with these psychiatric disorders, and you don't need other medications. Because remember, I told you that serotonin is made in the gut. And if you have too much serotonin, you have this thing called serotonin syndrome, which is going to make you feel even worse. So serotonin syndrome can happen if you have too much serotonin. If you're given a serotonin type medication for your anxiety or depression, when it's an imbalance of a hormone and not an imbalance of serotonin. So by treating these things correctly, you don't need to have these medications that have the side effects that go along with them. And you also are going to decrease your risk of a hormone-related cancer. We have to look at the big picture. And unfortunately, in our current model of healthcare, we are segregated. We look at different systems instead of looking at the whole body. So as I said, estrogen regulates serotonin levels. Progesterone is calming. So when we manage it with progesterone, you're calm, you sleep better, you don't have the mood swings, you don't have this all over the place. But progesterone also has to be more of a natural type of progesterone that is not the synthetic, or it will have its own issues. And then we have testosterone that maintains neuron function, and neurotransmitters are what regulates serotonin also. So the hormone cancer connection, I think I've went over this and that you're getting it, but now let's summarize it. We have hormone imbalance. It's about estrogen metabolism, not estrogen itself, but estrogen metabolism. Insulin, inflammation. And this test right here, I'm going to give you a special mention with this today because I think that this should be the gold standard of hormone testing. I do blood tests also. This right here, every woman should have this test done because it will tell you the precursors to your hormones. It will tell you your hormones. It will tell you your metabolites. So it's telling you not only the hormone that you have, but how that hormone is being metabolized. It tells us progesterone. It tells us testosterone. It goes into your cortisol and your melatonin levels. These are all hormones that are so important. It is the most extensive, comprehensive assessment of sex and adrenal hormones and their metabolites. So you can get this test. You don't even have to see me to get this test. You can go to my website, marshajonesnp.com, and there is a link on there for testing. You can order this test. You can do this test and you can get the results. It's saliva and urine. So you don't even need to get your blood drawn. You send this off, they send you the results. You want it managed, you can talk to me then. If you don't want to do the whole, let's set up a consultation and you want to see what's happening first. But I highly recommend that when you get these test results back, you work with someone who is an expert in this, who is trained in this. This is where functional medicine excels because we look at things in a totally different light than what traditional medicine does. I can tell you, I've done traditional medicine. I'm trained in functional medicine. They do not teach you this in traditional medicine. Those of us who go into functional medicine, almost always it is because we are so just disappointed in traditional medicine and the protocols that just push everybody towards pharmaceuticals. It doesn't educate. It doesn't try to teach you. It doesn't rebalance you. All it does is promote pharmaceutical prescription under protocol. It doesn't look at you and who you are. And I'm sorry, I'm getting a little bit worked up and passionate about that, but that is why I do these things. And that is why I try to teach and educate. And this is why I work at rebalancing from a totally different spectrum. This is important. Order this test, find out where you sit, and then get someone, even if it's not me, get someone who is trained in functional medicine specifically to help you manage the results of this test. Here are some resources for you. I think that we've covered it all today, and tomorrow, like I said, we're going to go into the hormone focused balance of hormone focused treatment of cancer. Free guide to preventing cancer is I'm going to give you the resource. Free guide to 5 signs of imbalance, the health interventions for cancer program, and 6 months of one-to-one consulting and coaching program with me. Those are the resources I have available to you right now. This is the 21 ways to boost your immune system to prevent cancer. This is a free guide. It's at marshajonesnp.com/cancer prevention guide. You have to put those hyphens in there if you're doing that yourself, if you're not using my link. This is 21 things you can do to boost your immune system to start getting it into alignment to protect yourself, and so that it is ready to identify any of those foreign things that turn into cancer cells that can replicate when your immune system is weak. Then we have the signs of imbalance for women. This is a free guide, marshajonesnp.com, signs of imbalance guide for women. This one is at the bottom of every page on my website that you can sign up to have sent to your email. It is a guide on what is happening to imbalance you in the signs that show that you may have a hormone imbalance, and how the neurotransmitters and the hormones are interacting to cause that imbalance. The health interventions for cancer program. This is my current baby I'm kind of proud of. This program covers everything. You think I've given you a lot of detail in the last 2 days? This program covers what cancer is, how cancer happens, general nutrition, phytonutrients, genetics, environmental toxins, the immune system, inflammation in cancer, stress in cancer, sleep in cancer, hormones in cancer, the microbiome in cancer. It goes through everything. There's just so much that you need from this. We go into medicinal mushrooms. We go into the natural ways to balance your hormones. We use herbals, and just it is the all-inclusive, all-comprehensive, every type of cancer foundation that you need to help to protect yourself. It is not as hormone-focused as what this current seminar is for you, but it is in general, so that whether you're a man, female, woman, whatever type of cancer it is general advice and information. That program is only $497. So that is way cheaper than seeing any kind of healthcare professional. If you're a do-it-yourself or you want to, learn everything that you can learn and you be guided in the right direction, it's an amazing price. And just for, listening to these webinars and this summit, you can get that for $397. Just go to marshajonesnp.com services. You will find the health interventions for cancer program, and you put in that 3-day summit code and you get it for $397. So what about that? You don't want to miss it. Trust me. And then if you would like to work with me, I do one-on-one consultations. There are weekly phone calls. It's progress tracking. It's accountability. We have messaging in between our visits. It's motivation. This is where I am your personal functional medicine provider, your cheerleader, motivator, advocate, counselor, confidant, and just your personal health expert, all in one at your fingertips. And I do 6-month commitments because you are not going to give up on me. If you sign up for 6 months, I don't give up on you. You don't give up on me. We get this done and we change your life. We may even save your life. I'm that confident about it. So this is the program overview of my one-on-ones. We work with we assess to find your current health goals and motivation. We identify the mind, body, and spiritual needs, functional testing in labs, hormones, nutritional status, gut health, that's all included. Action. This is where we take action. We treat the functional imbalances that we find. We rebalance your body. We repair, we detoxify. We work on nutrition, sleep, stress, and emotional healing. So I only have limited spots available for this one-on-one because it is so detailed, so one-on-one. You get so much support that I can only do so many people in a week. So if you're interested to working with me, go to marshajonesmp.com. There is a form of interest that you fill out. It's under the Work with Marsha section. My team will reach out, they'll review how the program works, discuss availability, and if we are a good fit. So you have to be ready to make the changes and know that it is a journey. This program is not for anyone who wants a quick fix or a gimmick. The program is not for those who resist making changes in their life. There's going to be moments that you're going to be frustrated. You're going to want to give up, but that is why you need me. And that is why you need one-on-one coaching. If you're someone that has tried and given up and tried and given up, but you really want to make a difference, that's why you need me. I won't let you give up. You're stronger than you really think. And you just need someone to help you know that. And unfortunately, a lot of women need that empowerment and someone to stand behind them because they don't have people in their life that are going to tell them just how strong they really are. There's going to be times of celebration. There's going to be absolute joy from your accomplishments. And I'm going to make sure that you know those celebration times and you know those accomplishments and that you don't forget them as you go along the way. Because everything matters. Life's ups and downs. It's about choices. You're going to learn how to appreciate and you're going to learn how to learn and from each and every struggle and triumph. So when you work with me, again, hormone management, weekly health coaching, unlimited messaging, so we can figure this out, and abundance of materials for you to use during the program and beyond. It's not a just give you the program and see you figure it out, but you have them at your disposal so you can go back and look at them. And then there's health-related emails, there's Health Interventions with Marsha Jones Facebook group, there's live events and post-event recordings on various hormone-related topics. You get it all. But remember, it is for those who are ready to find answers and to make a change. It is not a diagnose and done, figure it out, see you later kind of program. This program is not just eat better, move more. The program does not give you handouts and expect you to take it from there on your own. It does offer real life solutions that are customized to you. It covers nutrition, detoxifying the body and the environment, mind work, lifestyle activity, self-care, immune support, gut health, nutrient optimization, herbals, integrative therapies, and so much more. So to work with me, marshajonesnp.com, work with Marsha. Now, that's enough, right? Tomorrow is day number 3, hormone-focused cancer care. This is where I'm going to help you to reduce your risks and change the odds and beat the odds. So until next time, blessings in health for you and take care. Have a great day. We're going to end the meeting.